Okay, so good afternoon, everyone, and thank you for being with me again. So we finished our lecture with COVID vaccines. Do you have any questions about COVID vaccines before we proceed to the next slide? Please turn on your camera. Very good.
Sir, may I ask, sir?
Yes, Enzo.
Hindi lang siya, sir, galing about sa vaccines pala, sir.
Oh, it's okay.
Makot lang ko, sir, kung kagiman ka mo, sir, encounter nag-treat sang, naayo na bala, sir, sa COVID nga patients.
Okay. The typical scenario here at the hospital is we get into the patient, we get to treat patient post-COVID na. Damo naman kami patient nga amon gin-rehab post-COVID. Actually, in the hospital does not have a standard infection control rules and regulation about physical therapy because physical therapy is considered not essential in patient admitted in COVID ward. But if they will be discharged, if there is obvious weakness, there is physical inability, secondary to deleterious effect of immobility, again isolate sila for more than 14 days, then that's the time na we get inside in the scenario. Post-COVID, we do not treat patient while the patient is admitted in the COVID ward. There was a question this morning about patients, physical therapy patient, if kung gina-RT-PCR sila. Sige, I'm going to answer that one, but dapat hindi siya pwede ihambal sa iban, ha? Patients who receive physical therapy should undergo RT-PCR, and it is valid for 14 days. It is valid for 14 days. But if the patient fully vaccinated, 3 weeks after the second dose or 1 month after the second dose, hindi na sila kailangan mag-RT-PCR. That's the reason why our census today, medyo lubo because most of our patient does not want to undergo RT-PCR. The elderly are not afraid of the vaccines. They are not afraid of being vaccinated. Nila hambal, but they are afraid of submitting themselves in swabbing, RT-PCR and oropharyngeal. So ang muna nga naa medyo nubo ang amon census, and yes, compared to mga previous months, sang wala pa na-implement ang RT-PCR rule, damo ang patient.
Thank you, good sir.
You're welcome. Questions? Another questions? What happens if, yes, Alex? Yes. It's because it needs a second dose because the first dose is medyo weak siya. During the first dose, gamay pa lang na nga inactivated vaccine ang ara sa vial. Amo na nga naa, kinahanglan siya sa second dose to make the vaccine more stronger. Compared to your Janssen is first dose. It has something to do nga sa ila nga ging ubra sa vaccine. Siguro 100% of the virus is already inside the vial. amo na nga na ang Janssen, one dose lang compared sa iba nga mga vaccines nga kinahanglan two doses. You're welcome. Your Janssen is, I forgot. Yes, your Janssen is one dose and it is a viral vector. What if a co-staff got COVID? What happened to the other staff? Are they being quarantined in the hospital? Sa among dili, gina-quarantine ba lang iban nga staff? No, we don't do that here because that is the memorandum being given by TOH. You will only get swab. You will be swabbed only if you will develop symptoms. But the department or the floor is under monitoring for 14 days. So everyone would report to the infection control, would call or would text that mahambal sila kung kamusta nila pamatyan. Subong sa amon, um, duha na ka-staff ang na-COVID before but naka-recover na sila. Ang subong may bag-o, ang amon ng orderly who resides in Oton. So how many of you here lives in Oton? Take note, tamaan kataas ang COVID case sa Oton, Haniway, Dumangas, Barotac. So may mga, may mga reports na there could be already transmission of Delta variant in Oton. Na siya. Okay na? We're good? Okay. Is my audio okay, guys?
Yes, sir.
May nagsulod nga isa. Si Blessing. Okay. May duwa pa gid gani. May duwa pang huway kasulod. Sige lang.
Hello sir, may question ako.
Aha. Si Val.
Tugbang. Hindi na siya vaccine related, but required na ang bandana niya, sir?
We wear bandana if we do not have head cap. We do not have head cap. Wear kami bandana kay earlier may patient. So nag-PPE kami. So kinahanglan may ara ikaw bandana sa sulod or may ara ikaw head cap para hindi magdagdag ang ibubuhok sa sulod while you are wearing the PPE. Hindi ka pa lang head cap. Ang
Tinatawis?
Oo. Because if kung laba imo buhok like ang mga female staff, kinahanglan nila mag-usar bandana or head cap because ang amo nga head cap, we call this the Ninja Turtle. Kaya kung hindi mo siya kung hindi mo siya head cap pag ibubuhok or hindi mo siya pagtabunan, magwa imo buhok. Ang imo nga buhok magwa diri sa ang bangs mo. Gagwa. So hindi pwede. So amo na nga naan ang some of us wear head cap, headband para hindi na bala para hindi na siya pagkwaon-kwaon. Oh, please, thank you. Para hindi na siya pagkwaon-kwaon. Para kung may next patient na mag-abot mo, usar ka na lang PPE. Hindi mo na kailangan pa imubuhok. Hindi mo na kailangan ipungson. So, amo na ka na nag-usar kami bandana, may iba nag-usar head cap. Sa amon, ang mga female staff, they are using head cap, non-woven. The male staff wears bandana. May ara man iban nga male staff nga wala naga bandana. If you are also fond of holding or fixing your hair with your hands, nga wala mo na disinfect, wala mo na alcoholan, pwede daan ang imo nga buhok magka-harbor pathogens. Amo na nga na kung kasakay ka sa jeep, dapat ang imo buhok ano mo siya, kunguson mo siya. Kaya kung di mo siya pagkunguson, pwede siya magkadto sa plastic sa jeep or pwede siya maigo sa tawo sa pihak sa likod. Kaya ang aton nga buhok, without knowing, kasi higo ka mo ta, wala kita kapang alcohol, gulpi lang ta, makayos ang aton buhok, makayos ang bangs ta. So as protection, also, protection purposes, we wear bandana and headband.
Thank you, sir, for enlightening me.
You're welcome. Are we okay? Let's proceed. Sige. Okay. Prevention of infection. Number one, we should always clean our hands with soap and water for 20 seconds. If there is no soap and water, we should always bring our own alcohol, 70% isopropyl or ethyl alcohol. Take note, it should be 70%. We have 40%. Your 40% cannot deactivate SARS-CoV-2 or coronavirus. Take note. Your 40% cannot deactivate your SARS-CoV-2 virus. Safe distance. It is very important to always practice social distancing to at least 2 meters. Why? Because the patient coughs, as what I mentioned this morning, if a COVID patient coughs, kanta, magwa ang laway niya, wa ang droplet nuclei niya, pagwa sa iya droplet nuclei, in less than 1.5 meters, mahulog na siya sa floor. But if you are practicing safe distance, 2 meters, hindi ikaw maigo sang iya nga droplet nuclei. Not unless may ara hangin nga nag-agi sa imo, kag dala niya ang droplet nuclei, may possibility nga imo siya mahaklo, imo siya ma-inhale kung wala ikaw mask. Now, prevention also is the use of mask. Cloth mask or surgical mask, okay lang. For regular individual, they can use cloth mask. But take note, if you will use cloth mask, you do not have protection. You can protect others because if you will cough, if you will talk, ang cloth mask i-filter niya ang imo nga laway, i-filter niya ang air nga imo ginapagwa sa ilo kag sa baba. But if there is a virus, it can get inside the cloth mask. The SARS-CoV-2 point the SARS-CoV-2 is 2 micrometers, meaning medyo dako siya. Medyo dako siya. May mga study nga naghahambal nga hindi niya kaya magsulod sa cloth mask because dako ang imo nga SARS-CoV-2. So maski sa picture pa lang daan, kung lang tawo nato ng akong nga background, sa tsura pa lang sa imo nga SARS-CoV-2, dako na siya tulokon. There are study that says na hindi niya kaya magsulod sa cloth mask. But if your cloth mask is ang iyang consistent, ang iyang text, iyang architecture sa imong nga cloth mask, hindi gitamaan bala kagamay, medyo dako siya, nga may mga micro holes, pwede inasudlan sa aton nga SARS-CoV-2. Next is, don't touch your eyes. If you're fond of kalot-kalot your eyes, don't do that. Don't touch your eyes, your nose, and your mouth. as well as your ears. Kung makatulang imo nga mata, kung katulang mata, diri ikaw kalot sa temple mo. So i-move it. Kita nyo ko, muna-muna lang for circular motion. But kung gusto mo gidya nga kaluto ng imo nga mata, sanitize your hand with 70% alcohol or your gel sanitizer. Take note, if you will sanitize your hand with an alcohol, you have to let it dry. It's called rubbing alcohol because you have to rub it. Rubbing alcohol until the alcohol gets dry. Same as with your gel sanitizer. Ipamalahon gid ang gel sanitizer. Comparing to nga ging spray mo lang ang alcohol, in-spray mo lang ang alcohol, tapos ging pamala, chances for the virus is pwede nga hindi siya mapatay. Kaya wala mo siya ging grab. Mo man na siya kung manglimpyo ka dara sa surface nyo, kung sprayan mo siya sang sodium hypochlorite. What is sodium hypochlorite? It's your Zonrox. It's your Zim, your Winrox. So in 1 liter of water, in 1 liter of water, punon mo siya, kag ang imo nga Zonrox is 1 cup of it. Isa ka taklob sang Zonrox is good for 1 liter of water. Muna siya maglimpyo. So you already have Zonrox solution. So you put it on a spray and then you spray it on the surfaces sa balay ninyo kung maglimpyo ka mo, and then wipe it. Why wipe? Na hindi siya pag-ipa-dry. Wipe because it is in friction that the virus will die. Take note of it. Take note of this. It is in friction that the virus will die. Now, stay at home para hindi ka ma-contact trace ang mga barkada mo da. Stay at home. Isa gadlagaw. The more nga galagaw ka, non-essential, dato ka sa coffee shop, tapos wala galigin trapuhan sang barista ang lamisa, tapos nag-ubo dira ang tawo, pwede nga makaptan mo to ang virus sa lamisa kag i-ano mo sa mata mo, talugon mo sa mata mo, talugon mo sa imo nga cellphone, dalon mo sa balay. That's the reason why my cellphone, my cellular phone is enclosed in a plastic. Why? Because pwede ko siya maalkoholan pag huli ko. Kaya kung i-directa mo siya alcohol sa imo nga phone, basi maguba ang cellphone mo. So alkoholan ko siya, all surface, and then I will open it, and then I will pagwaon ang cellphone, and then set aside na ang plastic. Seek medical attention if with symptom. So kung law ay matsyag mo, flu-like symptoms, pa-check up. If hindi ikaw pa-check up, stay at home and monitor. Pwede na subong, ang mga doctor subong, pwede na sila matawgan, pwede na sila ma-chat, pwede na sila ma-text, respond na sila. Kaya balaan nila, kinahanglan gid sang mga tawo nga, kinahanglan gid sa mga tawo medical attention maski hindi sila kagwa. So gatawag sila, tawag ka mo. Take note of that. Okay. Persistence of coronaviruses on surfaces. Aluminum, 2 to 8 hours. Okay lang. The next day, patay na ang virus sa aluminum. Aluminum sang bag, ang imo nga water bottle made of aluminum, 2 to 8 hours. Surgical gloves. Even though your surgical gloves is a latex or is latex, 8 hours after na mapatay ang coronavirus. Steel, doorknob, faucet, 48 hours. The more the object is porous, the more the object is hard, mas dugay dira magstay ang virus. Say for example, let's check this one, your wood. Any types of wood, all types of wood, 4 days. Glass, mirror, your window, your baso made of glass, 4 days. Paper, bills, 4 to 5 days. You go to the grocery store, may plastic na, may ara pa resibo. So ang plastic 5 days, ang papel 4 days. So when you go to the grocery store, discharge the plastic or set them aside and then touch them after 5 days or after 4 days, including the paper also, including your resibo. How about the fabric? It's only good for 2 hours. The virus will only stay there for 8 hours. In fabric, uniform. Protocols for entering your home. If you were outside the house, you went to SMCT, you went to a lot of place, 8 hours kang nadula sa balay nyo. So when you come home, try not to touch anything. It's very important that you have a bottle of alcohol outside your house. May chair dira, may lamisa dira, may ara alcohol. Para pag abot nyo, pump lang. Hands up to the elbow. Okay, sa mga dog lover, disinfect the pet's paws if you were walking it. Take note, kung ang mga dogs nyo, ginpagwa-sagwa, I do not know kung paano, wala lang ko kabalo kung paano ni siya i-disinfect. Basi bala kung itapuhan yung ka-alcohol, masimutan sa ido, mapatay sila. I just do not know how. Next, take off your shoes. Ang imo nga shoes, ang slipper mo, naging dala sa gwa nga nagpa-grocery store, ibilin sa balay. If you go out, you go to the store, sari-sari store, it's best nga may ara ka mo tsinela sa gwa nga pangwa kag may pangsulod man. Number 4, take off your outer clothing and put it in a laundry bag. That is very OA, no? Very overacting. Take off your outer clothing and put it in a laundry bag. Kung kaya man lang, nga kung nagwa ka mo sa balay, na grocery store, and then may ara dira laundry bag sa gwa sang door, pwede gid. Provided sa sulod may ara ka na imo nga cycling or may ara ka kamiseta para pag sulod mo diretso dayon sa CR paligo. For a while. Ron? Okay. Kung hindi ka mag-take off sa imo nga clothes, okay lang man. As long as pagsulod sa balay, hindi magbunggo sa ibang mga bagay-bagay, hindi magkaput sa ibang mga bagay-bagay. Pagsulod sa balay, upa sa banyo, paligo. Leave bag, purse, keys, etc. in a box at the entrance. Overacting in naghimo ni. Number 6, shower, or if you are not able to wash all exposed areas, utangan alcohol. Clean your phone and glasses with soap and water or alcohol. Clean the surfaces of what you have brought outside with bleach before storing. Your bleach is your Zonrox, your Winrox, your Zim. Medically, it's called your sodium hypochlorite. Remove your gloves carefully and throw them away and wash your hands. Remember, it is not possible to do a total disinfection. The objective is to reduce the risk. Now, what are the PPE that we will use if later on, maybe in the next 5 months, pandemic will end? Wala na COVID. Pabalikon na kamo diri sang inyo nga makatuon na kamo sang school niyo. Sa mga sa hospital, sa St. Paul, sa doctors, pati pa sa Cebu, sa Riverside. So ano ang mga PPEs nga aton usaron? Anong mga PPEs nga mga PPE ang inyo nga usaron? PPE is called your personal protective equipment. or your PPE. So for regular people, they can use cloth mask, provided that it is thick, approximately 2 to 3 layers, para sigurado hindi makasulod ang SARS-CoV-2 or ang coronavirus sa mask. You can also use your surgical mask, provided that your surgical mask is always covering your nose and your mouth. Wala siya dili sa dalog. When you use your surgical mask, for sure, kabalo na kamo kung paano magamit ang surgical mask nyo. Dapat using your finger, with your finger, i-contour diri sa likod, i-contour diri sa front ang plastic part para magkupo gid siya sa ilong mo. Problem is, paano na lang kung panguang sorry. Paano I'm sorry. Paano na lang kung hindi mataas ang ilong ng tao? Paano kakabit ang surgical mask? So ang pwede obrahon dira, they would use a ang rubber, ear protector. It's like it's a material that we use para itay ang duwa ka end sang mask para gakapot gihapon ang mask sa mga individuals nga do medyo pangu ang ilong or medyo hindi taas ang nose bridge. So amo na ang ginaubra nila. Importante gid for me, ara gid ang surgical mask gatapon sa ilong kag sa baba. Maski ara ka lang sa SM, ara gihapon. Now, question, paano nahidlaw ka gid mag-dine-in? Lantawon niyo kung ano ang area nga inyo ginkanan. Damo ba na tawo ang inyong kanan? Kung damo tawo, hindi magsulong. Next, check kung open or closed. Jollibee, McDo, medyo risky gawa. I myself, kas aga hidlaw ka. Kakidlaw ko magkaon sa Jollibee. But ano ko gid na hindi gid because if you eat inside the restaurant nga closed, tapos ga-on pa gid ang aircon, medyo delikado. Choose a restaurant or choose a coffee shop na open, like your coffee break, open sila, open air, hindi ka po nakapangapi. Your KN95 here is your KN95 is an equivalent of your N95. Your KN95 is an N95 made in China, while your N95 is made in the US. So let's compare the filtration rate of your N95 and then your KN95. Your N95 has 95% filtration rate. What do we mean when we say 95%? I mean, your N95 is 99% filtration rate. What do we mean when we say 99 filtration rate? Almost all particles can be filtered by your N95. May it be oil-based, may it be solid particle, maski ano pa nga virus, kaya sa imo nga N95. 99% filtration rate. How about your KN95? Your KN95 has only 95% of filtration rate. Medyo nubok bawang. Kung ipapilion ako, what will I use, N95 or KN95? I will go with N95. Though you will have a hard time breathing inside the N95 because your KN95, ang iyang ang iyang garter is pareho siya sa imo nga surgical mask nga tapik sa dulunggan. So may iban nga mga KN95 na tamaan ka gamay, tamaan ka dako. So hindi siya hindi siya proportion sa imo nga face. So kung hindi siya proportion sa imo nga face, pwede nga may malik nga air, pwede nga mag-open siya kag masulod dira ang pathogens, ang mga airborne pathogens. Your surgical mask, it should be waterproof. The outer part of your surgical mask is waterproof. The middle part is non-woven, and then melt down. What do we mean when we say melt down? So if you cut open your surgical mask, paod mo ang tunga nga part, sunugon mo siya. Kung sunugon mo siya, hindi siya magkalayo, dapat ma-melt lang siya. Dira mo mabalaan kung fake or hindi ang imo KN95 kag imo nga surgical mask. So the first thing you have to check is pila ka layers ba lang imo face mask. So buksan mo siya, open mo. Now kung na-open mo ng imo nga surgical mask, kuha ka sang part sa sulod, sa in between, sa inner part. And then sunugon mo siya. Kung sunugon mo siya, dapat hindi siya magkalayo. Kaya kung magkalayo siya, meaning it's not meltdown. Dapat ma-melt siya. Amon laging tawag siya meltdown, kaya dapat mag-melt siya. Now the next is water. You test your mask. You get the surgical mask, ihimuon mo siya do cup, i-cup mo siya, and then ulaan mo siya tubig, and then wait if the water will exit. If the water will go out, meaning your mask is not authentic. Your mask is waterproof. Face shield. There's always an issue. There is an issue about using the use of face shield in public place. You know us, all of us, though hindi na kami kasaho nga wala kami face shield. Every time we go out at the rehab department to go sa canteen to buy our food, kumalipatan namon ng amon nga face shield, gabalik kami sa sulod, gabalik kami sa rehab, kinalipatan namon ng amon nga face shield. If you are indoors, it is important na may ara ikaw face shield or may ara ikaw glasses to protect your eyes. But if you are treating patient, dapat amon nga face shield ang ginagamit. Face shield with garter from behind. This is the face shield that we use when we treat patients. We don't treat patient kung amon ang amon na face shield. There are times nga kung wala na gid, amon ni ginagamit. But if you will get inside the COVID ward, dapat ang imo nga face shield amon ni. May garter sa likod. Hindi ka pwede ka rounds sa COVID ward. Hindi ka pwede ka rehab sa COVID ward kung amuni ang imo face shield, eyeglasses na face shield, because this will give you very little protection compared to face shield with garter. That's the PPE that we use. It's waterproof. The tela is called taffeta. I don't know if it's taffeta or taffeta. And there are some healthcare workers nga gagamit sila sang mga elastomeric mask or elastomeric respirator. So amo ni siya, medyo budlay ni siya magginhawa diri. Kag kung maghambal ka, hindi gawa klaro imo nga ginahambal. But this respirator or this elastomeric mask has 100% filtration. It will filter all substances that will get inside the filter. So that's Sir Martin. Sir Martin already resigned last March, and that's Miss Claire, and that's me in between. And in worst case scenario, if ever there is a need to wear the coverall, then we use this with shoe cover. So that's your coverall. This is your isolation gown, level 4 isolation gown, and this is your level 4 coverall. Bakit pa coverall? So imo nga tiil, imo nga kamot, protect imo nga liog sirado gyud. That's my last slide. So we're done with the lecture. Any questions? Because after this, I will be showing to you a video on how to properly don and doff PPE. Any questions? Ay, harap ka dali. Questions? When you wear your PPE, dapat wala ka earrings, wala ikaw wristwatch, wala ikaw sing-sing. Kaya kung may sing-sing ikaw, pwede mo magisi ang imo nga gloves. Dapat wala ikaw accessories nga imo ginagamit kung mag-usar ikaw sa imo nga PPE. Okay na ta? So I will be presenting a video. I hope the video is audible sa inyo ha.
How to safely put on personal protective equipment for PPE. I will demonstrate how to appropriately put on or don PPE. Prepare your PPE. Put on medical weather isolation. It reduces the healthcare provider from the spread of infection if the wearer comes in contact with potentially infectious liquid and solid materials. Isolation gown should be waterproof.
Ang hindi lang ako patayaman pa tayo.
Low sole Velcro strap.
Pero siguro tayo ako na magagawa. Kaya ko naman sila
Secure all ties. Put on your head cover. Put on outer head cover. Head covers are used to protect the hair and the scalp from possible contamination with sprays or airborne exposure is anticipated. Put on shoe covers. Its purpose is to prevent potentially hazardous material, including organic and chemical particles, from coming in contact with the bottom of the person's shoes. Shoe covers should be waterproof. Perform hand hygiene using 70% isopropyl methyl alcohol. Put on face shield. They are plastic face visors that provide full face protection. Fix and elongate your sleeves. What about surgical gloves? Surgical gloves prevent contamination of healthcare providers' hands and help reduce the spread of pathogens. You're all set and ready to treat your patient.
In this video, you will learn how to tag or remove your personal protective equipment, or your PPE, in accordance with Center of Disease Control Protocol. Following the docking protocol will minimize the risk of disease transmission. Remember, don't rush during the docking process. Disinfect gloves with alcohol-based hand rub. Pinch the outside of the gloves near the wrist. Peel downwards, moving the gloves inside out. With your ungloved hand, slide your finger under the wrist of the working glove. Peel downwards, turning the glove inside out. Discharge gloves. Tilt your head forward and remove the face shield gently, leaving the mask and head cover. Tilt head forward and remove gently the outer head cover by opening the Velcro strap. Remove and discharge. Perform hand hygiene. Remove inner head cover and discharge. Remove your isolation gown. Untie all ties. Open all Velcro strap. Reach out to the shoulder and carefully pull the bag away from the body. Roll in the bag and discharge. Perform head hygiene.
Number 3 on site support group. Number 3 on site support group.
Remove sheet cover by sliding your finger inside and carefully pull down the cover away from your foot. Make sure you do not touch the outer surface of the sheet cover. Discharge sheet cover. Perform head hygiene. Remove mask carefully without touching the exterior part. Pull it forward and away from you. Discharge used mask. Perform head hygiene.
Okay, so that's how we do donning and doffing of PPE. Take note, everyone is not required to buy their own PPE because we will not have a demonstration on this. It's okay. Later on, if kung ari na kamo sa clinics, then we will teach you face to face and how to properly use and discharge PPE. But I think requirement nyo na sa school nyo ang PPE. And then also, some centers requires intern to have PPE because nagapademo sila donning and doffing. Okay? So, any questions before I make my announcement? Any questions about our lecture? Okay lang? Okay, sige. There will be no lecture tomorrow about tele-rehab. I will just announce when the lecture for tele-rehab is. I would like also to grab this opportunity to inform everyone that you will have your second live reporting. So the same thing will happen during your first live reporting. It's just that we will separate you. So interns from St. Paul, your topic, your topic is OA and arthritides, RAOA. Please take note. Interns from St. Paul, your topic is RAOA. Interns from Iloilo Doctors College, your topic is burns. The four of you. For RCI and for returning interns, Andre and Danica, you have your own topic, and then you also have your own schedule of reporting with Miss with Miss with Miss Faye. But of course, if kung may mga available na staff will also be there to listen on your reporting. Now, when is your reporting? St. Paul intern from St. Paul University, your reporting will be on September 15, so that's going to be next week. Take note of that. Just check the syllabus that we gave. Next, interns from IDC, your reporting will be on September 17. Okay?
Yes, sir.
RCI and returning interns, may reporting ka mo, boss? What time?
Wala, sir, nakabutang sa syllabus.
But are you prepared for the reporting tomorrow?
Yes, sir, managtapos naman nga PowerPoint.
Okay, so I will just inform Miss Faye kung saan uyak ka mo pa-report on. So you will be there to listen. So the guidelines also for your reporting is ara man sa syllabus. So just download the syllabus and then read it. Ara lang gid na. And then ma-announce lang ko kung saan ang lecture ta for tele-rehab. And then on Friday, September 10, you will have integrative clinical examination together with bed mobility and transfer. So what is this integrative clinical examination? Tanan and anything under the sun. So ang inyo nga machine nga fabricate, hindi nyo pag i-dismantle because we will use that. We will use it. Ang mga machine nga waay ninyo nagamit during your major clinical examination last month, we will use that. I don't know with RCI interns, do you have dummy machine? May dummy machine ka mo? RCI.
Hello, sir. Wala kami, sir, dummy machine or ga-assume lang.
Oh, assume. Sige, we'll see kung what will happen with your integrative if kung ano, after the reporting siguro, we will instruct RCI interns to make your own ano siguro, to make your own dummy machine para at least gamiton nyo siya for your clinics. Okay? So, next is, muna lang. So, any questions about the lecture about SARS CoV-2? Okay na ta? Are we all okay?
Permission to speak, sir.
Yes, Daniel?
Regarding sa archetype, sir, ma-focus lang kami sa RA and OA. Hindi
Yes,
lang.
RA and OA.
Okay, sir.
Your RA, damo-damo na sila. Tungaan nyo ng tanan.
Okay, sir.
While your osteoarthritis is just osteoarthritis. While your
Sige, sir.
arthritis, damo na sila. We have your SLE, your scleroderma, your anong pa da? Diba damo na sila? Juvenile, whatever. Okay? So tungaon nyo lang lecture and also physical therapy management and medical management. So imo ka mo kang inyo naman nga group chat para at least mabalaan yung kung sino ma-report sa amo nga topic. Okay? From time to time, I do not know with you guys if you always stay at home, but it's also best for you to unwind, to go out, to refresh your mind and to see the outside world, kung anong kakatabo sa mall, anong kakatabo sa city, provided that you have to exert precautionary measures. If you happen to see your co-interns, if you happen to see your classmates sa mall, beso is not a thing anymore. Oh my God, I miss you, and then makupo ka mo. No, it's not a thing anymore. So if you really miss your classmate, you just fist to fist or elbow to elbow. So that's the thing anymore. It's tamaan ka delikado subong nga maglinugdanay because the level of transmission right now is pang pamilya. If you will be infected in the office or in the hospital, in your workplace, you will bring the virus at home. And then what if bitanan ka mo nga family is asymptomatic, and then you go out, you meet with your friends, and then nalatnan ng imong friend, nalatnan man ng iyang family. So okay lang na nga maginuwa ka mo, okay lang na nga maglagaw-lagaw to unwind, but what's important is you exert precautionary measure. And you know that, balaan nyo na kung ano ang inyo obra. Kaya amo na permi ang ginahambal sa inyo sa mga parents nyo, amo na permi ginahambal sa inyo sa mga clinical instructors nyo sa school before kung ano ang dapat obra mo. And you enjoy the company of your family. Kung sang una, sang board ka mo, boarding house, kasa ka lang kapuli sa balay ninyo. But today, it's different. You stay at home, you enjoy the company of your family, you appreciate the uniqueness of each member of the family. Because before the pandemic, wala ka kahibalo nga, ay si Amuni, ay ala si ang magulang ko gali talented nami gali talent niya sa Amuni. Wala mo siya makita kay before the pandemic, ara ka permi sa buwa, nag-board ka, nag-boarding house ka, mo makita ang family members. And now you make an outlet wherein everyone gets online and then you talk to each other. You do virtual tagay. I don't know if you're doing that. Are you doing that? Do you do drinking session with your friends online? You do that. You try it next time. But at least you kamo nga from St. Paul, you gather all your classmates. Kamo nga from Riverside, you gather all your classmates online. You make a program. We do it here at the rehab. We are doing that. We are making program. Kaso wala lang kami kakaundungan because we're doing it at night. 8 in the evening, 9 in the evening. Ara man si Doc. So, there's a live talent. May ara nga showcase of talent, pero dapat ang imo nga talent kagin video is kagapon lang ginkuha. Hindi pwede nga last week mo pa last week mo pa ginubra. We're doing that for mental health, para mahambal mo kung ma-share mo man sa imo mga upod. Kaya kung diri sa rehab, we have our own world. Each of us has its own plinth. Plinth A, dira siya. Plinth A, dira siya. Plinth A, diri si Miss. Plinth A, dira si Miss. And we don't eat together. Take note, taman ka risky ang magkaun, ulog danay sa table. That unless you have a very wide dining area, and then it's open, okay, good. So are we good now? Are we okay? Sige ha.
Yes,
And
sir.
also in terms from RCI, you make an online meeting with your co-interns from RCI also, and then be the host. Kubra ka mo program, may prayer, and then showcase of talent. Okay? That's for mental health.
Sir, excuse me.
Yes, Andre.
Sir, maas lang ko, sir, regarding sa integrative with bed mobility, sir. Kami pala, sir, ni Danica na paano na kami last June. Maliwat lang kami, sir.
Oh, yes. We will check on you kung how much. We will check on you kung ano kadamo pa ang na-retain ninyo sa gin-lecture namon sa inyo. Naka-attend ka mo lecture tele-rehab? Wala pa, no?
Wala pa, sir.
Wala pa. Okay. Usually tele-rehab is Sars CoV is during second month. Okay? So are we good now?
Sir, permission to speak. Sorry, sir.
Yes, Gabi. Okay lang.
Yes, sir. Regarding your lecture, sir, may I ask, sir, if you're permitting patients to take off their mask if ever, sir, they feel suffocated during exercise?
Hindi gid pwede.
Okay, sir.
Hindi gid pwede. If we will treat Bell's palsy patient, ara siya sa sulod, naka-drape ang cover, and then naka-IR siya, open ang window, kag sagwa ka. That's the only time that we will permit patient to get his or her mask kung may Bell's palsy siya, para ma-expose it ang iya IR. Na-remember nyo, during our virtual tour, medyo hambal nila kung nung sulit itong akon nga camera, wala ko idea. So during our virtual tour, the speech therapy room, may ara kami the Bell's palsy booth. It's where the patient exercise, may mirror sa sulod, kuha ni the mask niya, tapos ikaw ara sa gwa. So the booth, the acrylic barrier will serve as protection. And then after that, bye-bye. And then after that, after treating patient with Bell's palsy, nga kuha iya mask, cleaning, everything should be wiped. The floor should be mopped with Zonrox. But if elderly patient nga hapo gid, we permit them provided that you have to open the window right away para masaksyon ang iya gina-exhale, para gasaksyon. So kung balaan namon nga mag-ayo ang patient namon nga kwaon nila ang ilang mask, gapalayo kami, because pwede ka gyapon malatnan maski naka-surgical mask ka lang tapos ang patient wala, pwede ka niya malatnan kung asymptomatic siya. So if the patient would ask permission kung pwede niya makuhaan na iya mask for a short period of time para lang maka-inhale, exhale, maka-grasp air, we do permit it, provided that the window is open, and then you stay away from the patient. Palayo ka sa patient. Okay?
Yes, sir. Thank you.
You're welcome. Sige, ano pa? May question pa? Are we all good?
Sir, pwede ka ask, sir.
Yes, Hansel?
Sir, about sa tele-rehab bala, sir, ha? Mamakot lang ko tani, sir, kung kayo di ba, sir, ga-tele-rehab ka mo? Budlagan man ka mo, sir, mag-contact sa management.
Depende sa maging budlay siya kung hindi namin ang internet connection sa pasyente. Kaya hindi niya ma-pick up ang imo nga instructions. Kung maghatag instructions, maghatag order sa patient, okay lang. Hapos gid. Pero kung dito na sa ila, labi na gid kung hindi sila labi na gid kung wala medical professional sa ila, hindi ka bulong mag-transfer, mga patient wala nga mga on vegetative state nga gina-transfer, lateral transfer. Kasi ado ginakulbaan ka sa part ng patient kay basi mabuyan nila ang patient. So dapat nami gid ang imo instruction sa ila, kag clear gid ang imo audio. Sang una sang pag-start medyo budlay, pero after na do na use na kami. Dapat kung mag-telerehab ka, himuon mo nga interesting man ang imo nga telerehab. So nag-Google Meet ang patient. Kung mag-Google Meet, pwede ikaw ka-play sa YouTube, may music siya. So naga-PREs ka mo dira with music para hindi maburingan ng patient. Stretching ka mo dira, Williams, Mackenzie, and then machigong ka mo dira with background music. So pakita, may ara man kami gyapon video because I was the first PT who did the tele-rehab here here sa Amon. So video nila. So ipakita namon ang video kung paano gina-perform ang tele-rehab. And also, dapat ang mga patient, kung sa mag-tele-rehab kita, dapat ang pasyente nato, nayara man sila mga equipment nila para hindi man hapos, para hindi budlay sa ila mag-exercise. So some of them, gabakal, may iban nga alternative lang, mineral water bottle, may tubig sa sulod, it would act as sa ilang gamiton as PREs. And then other patients cannot really understand us because nagamask kami. So gina-explain lang namon nga hindi gid pwede makuha ang mask. Kaya ang amon tele-rehab laboratory it's a closed area. It's a closed area. Kaya karon kung gahambal ka da, giagsik ang imo laway sa keyboard. And then after mo tele-rehab, may next naman nga PT nga magamit. So ma-chat man to, ma-type man to ang PT. So if ever kung asymptomatic ka, makaptan niyo tong imo nga mga droplet nuclei.
Thank you, sir.
With regards to your final pre-assessment, we will be posting the rules and regulation on the weekend. Okay, so it's final, so it should be level up. Okay? Okay na ta?
Yes, sir. Thank you, sir.
Bye-bye. Thank you. See you.
Thank you, sir.
Hi, sir.
Bye-bye.
Thank you
Bye,
so
everyone.
long.
Bye.
Thank you, sir.
Thank you.